In our coverage of the Valley's healthcare crisis, nurses say patients at a number of hospitals are being put at risk and there's not enough staff to care for them. A nurses union calls for change and for lawmakers to mandate safer staffing levels. Some hospitals say it's an impossible situation. There's an extreme shortage of nurses. Mandates would mean cuts to services.
I've worked shifts where I've had more than I felt was safe. Not only the patient safety, which is the ultimate, but also our license. For a nurse, it's a gamble every shift.
Jody is a nurse in the Las Vegas Valley, represented by SEIU Local 1107. She testified before lawmakers calling for change. She says many nurses in hospitals and units across the valley are assigned too many patients to care for. Many nurses say it's not safe. That's why many quit hospitals or left Nevada.
When nurses had 10 patients on certain units, and 10 patients with 60 minutes in an hour, that's 6 minutes per patient.
If a shift feels short-staffed, what fears go through a nurse's mind?
That you miss something. There's something called failure to rescue, meaning we don't see something that we could have intervened on.
My mother-in-law was also hospitalized in a Southern Nevada hospital and was left on a bedpan for 4.5 hours.
Nurses call for the state to mandate staffing levels. Oregon and California have done so. A bill sponsored by State Senator Rochelle Wynn would do so for Clark and Washoe County. A nurse in a rehab unit would have a maximum of 5 patients. For surgery, psychiatric, or cancer patients, a limit of 4. Nurses would get only 1 patient if the patient's in labor or on the operating table. Advocates argue if there's better staffing, many nurses who left the hospital would return.
If all of a sudden our nurses are, at the maximum, you're going to have to send that mother to another hospital, or they're going to deliver in the emergency room, which is not a good alternative.
The Nevada Hospital Association says the nurses Nevada needs do not exist. Nevada ranks 46th in the nation for nurses per capita. To meet state standards, it would need 1,498 nurses now. Critics argue staffing mandates don't accommodate nurses getting sick or a sudden surge of patients. The chief nurse for Summerlin Hospital says there's not enough graduates to fill the void.
Summerlin provides the only pediatric oncology services in Las Vegas. To place ratios into effect could put those services in danger.
State Senator Wynn says she's going to continue to work with stakeholders to advance the bill and also find a balance between concerns and patients' well-being.